Robert Reich on your show yesterday made an interesting point where he said that, look, it's a procedural question about whether this even reaches the floor. But we have to take a step back and think about what we're doing here. We as Democrats are really risking watering this down to the place that we create a program that doesn't work. What is the real imperative that we have? We need to fix this problem. I think we're going to be judged very harshly by history and by the voters if we water this down to get Olympia Snow on board and we wind up creating a program that doesn't really work.
What else don't you like in the Senate Finance Committee Baucus bill? I gather there are other things other than that it doesn't include a public option.
Well, look, the Baucus bill fails to cover as many people as it should because it kept stepping back from the real challenge that we need to put on the health insurance industry to say you've got to do more. If you want to be part of this example, and as you know, I've been on the show saying that I think we should absent them from the entire formula by going a single payer route, then they've got to take some lumps here. And we really refuse to do that. I think the House bill is much better. It gets virtually 100% of coverage. It does so in a way that is financed in part by having competition to drive down costs. But the Senate finance bill, although the one that got a lot of attention at the end, was the weakest of the five bills, in my opinion.
On public option, did the insurance companies reinvigorate the public option debate by withdrawing their support last week for the Baucus bill, even though it had no public option? President Obama went after them hard in his weekend media address. Did they marginalize themselves and kind of create a backlash that will help public option get through?
Absolutely. I think and just for your listeners to catch up on some of this news, over the weekend, last weekend, the health insurance industry came out with a report that said if the Baucus bill passes, our rates are going to go up 111%. Which is exactly the argument many of us have been making, that it was a rare moment of candor by the health insurance industry to say, listen, if we have these added responsibilities, we're going to raise our rates in order to meet them, notwithstanding the fact we're going to have all these new customers. And I think that's exactly the argument that we've been making, is that they have been telegraphing that intention for a while, but they came out and said it. It was the best news for those of us who are trying to persuade our colleagues to come around to public option that we've gotten in a while. The health insurance industry is not going to be part of the solution. They simply are benefiting too much from the inefficiency that exists right now.
But from their perspective, if they're going to be required now not to deny anybody based on pre-existing condition, to insure everybody, to include various baseline things that the government's going to require in all insurance policies, and then you turn around and say, well, your rates can't go up. How are they going to do that and charge the same?
Well, the fact is that as much as 30% of everything the insurance industry takes in goes to overheads and profit. Yes, they're going to have to take a haircut here. They're going to have to do what they charge people to do, which is provide health care when people get sick, make sure that people are covered fairly and treated well. But without some hedge against their essential control over this formula, most Americans only have one choice of health care. They're stuck with it. And the question is, what is going to make them behave better? But they are not. If they continue to get 30% overhead and profits, we're not going to solve the overall cost problem that we have in the system.
Congressman Anthony Weiner of Brooklyn and Queens, central in the health care negotiations in Congress right now. And as you've said, you're an advocate of not just a public option, but full single payer, like in Canada, or Medicare for all. Do you see the public option as a path to single payer, because the public option may become more popular than any private insurance?
Well, we have had a 44-year experiment of two systems running side by side. The public plan in Medicare, for 44 years providing quality service, a lower growth in expenditures than private plans, and the private plans pocketing a good deal of money and creating terms like pre-existing conditions.
And it's really even more complicated than that and more confusing, because we've had Medicare, we've had Medicaid, we've had different kinds of private insurance. Now there might be this exchange that's set up for individuals without other coverage to go and shop. So there are so many different kinds of insurance systems within one in this country. That's part of the mess.
Well, that is, and that sprung up from meaning we in government, not taking Medicare, taking Medicare and making it 65 rather than, say, 55 or 45. That we've kind of allowed the free market to test out the idea that they can provide this care, and they frankly have failed. What I see the public option, and I think it's been oversold in a lot of places, what I see the public option is just a sliver of another test about whether government can do what we did in Medicare, which is provide better care at a lower cost. and the byproduct will be competition that the insurance companies will have to keep up with. But I do see it as a step in the right direction, and the only real cost containment that we have in any of these bills is represented by the public option.
Do you want to see – oh, no, let me ask you this. If we ever got to single payer well, actually, let me ask you to answer the question that I asked a minute ago. Do you see public option as a stepping stone to single payer? Some people accuse public option supporters of wanting to do that. Maybe you just want to do that and see that as a good thing.
Well, I make no bones to the idea. For me, a strong public option is a compromise position from my advocacy for single payer. We're going to have a vote on that. And it's funny, I get a lot of mail at countdowntohealthcare.com that talks about, don't back away from the single payer. But in direct answer to your question, I think it's going to have a more direct test of this question of which works better, fully government controlled or at least paid for versus insurance. And we're going to learn from that test.
So hypothetically, how would the government control costs under single payer? When advocates promote single payer, it sounds like everyone could just have everything at any time, and that can't be true, can it?
Well, let's look at the pool of money that we're dealing from. $2.7 trillion every year, enormous amount of inefficiency, complete absence in most cases of true competition for lowest cost for things like drugs and pharmaceuticals. So there's an enormous amount of money in the system. Think about the amount of overhead and administration. Walk into a hospital administrative office. Look at the 20% of their personnel that are not giving checkups, that are not doing surgery, that are just shuffling paper back and forth. I do believe we are spending enough money for health care in this country. I don't believe we need to spend any more. I think that what we need to do is start to spend it on health care rather than all the ancillary things that go into administering such a clunky, cumbersome system.